Good evening, everyone. Thanks for joining. We have Dr. Dipty Acharya from Fretz Neuro Vision with us this evening to discuss an optometrist role in vision assessment and rehabilitation following a traumatic brain injury. Thank you for being here with us this evening and sharing this information with us.
Hi, yeah. So again, I'm Dr. Acharya. I did have my other optometrist here, but she's gone with to hang out with her kids. But I have Deb here too. She is our vision therapist that works at our clinic. So what I'm going to be talking to you today is the optometrist role in traumatic brain injuries. So I hope. Oh. Sorry, hold on. Oh, there. So I'm just going to begin with explaining quickly going over what a traumatic brain injury is. It is an acquired condition. Oops, sorry, hold on one second. Okay. It is an acquired brain. An acquired brain injury is a condition that appears suddenly and results in neurological dysfunction. It can occur from an external insult, which can occur from sports, a motor vehicle accident, or industrial accident. So that's when you actually hit your head. And then it can happen from an internal insult like a stroke or brain surgery. Who is part of your rehabilitation team? So an optometrist should really be a part of your rehabilitation team. You will have your general practitioner or your family doctor, a neurologist, a psychologist or a physiatrist, a physiotherapist, a chiropractor, occupational therapist, a naturopath, a nutritionist. And if you haven't already seen one, you should definitely get your eyes checked with an optometrist. So why is an optometrist so important with TBIs? You do have to remember that 2/3 of your sensory information that the brain processes actually comes from vision. So that means that 1/3 of your sensory information comes from one eye, 1/3 from the other eye, and the rest actually comes from your other senses like smell, hearing, touch, proprioception. So that's why vision is so important with TBIs, because your brain actually processes a lot of information from your eyes. In a traumatic brain injury, what happens is the nerves that are used to process information are now damaged. So this will affect how your eyes work together. So your eyes might not be working well together in cohesion, how you comprehend information, and why sometimes previously easy tasks are now difficult. Some of your visual symptoms that you might experience after traumatic brain injury, there's a whole slew of them. So you might experience some double vision, which is called diplopia. Poor ocular motor function is, again, where your eyes are not tracking properly. Some people say it's like my eyes are moving around a lot. There's poor fixation, so you're not able to actually look at a target for very long. Again, I'll have patients say, I can't look at people's faces for very long. I'm always looking around and they're always thinking I'm distracted or not paying attention. It's just they can't fixate on a certain target for very long. Poor depth perception. So again, having issues with walking up or down the stairs, walking on the curbs, off the curbs. Photosensitivity is light sensitivity or glare. Unilateral spatial inattention, balance difficulties is quite very common in a lot of our traumatic brain injury patients. You might experience dizziness, vertigo, and nausea. You might have a heightened motion sickness, so just not being able to get into a car for very long without feeling sick. Intolerance for movement, decreased attention, mental focus, slow visual motor performance, memory problems, sleep disturbances, mental or physical fatigue, sore, irritated eyes during reading or computer use, dry or watery eyes, and reduced reading comprehension, loss of place when reading. So as you can see, a traumatic brain injury can really, really impact your quality of life and really impact a lot of things that you might have been able to do before the injury and are not able to do anymore. So what will an optometrist measure when you go see an eye exam, when you go see them for an eye exam? So for a regular optometrist check, so when people who are normal or haven't had a traumatic brain injury, an optometrist will check your visual acuities. They'll check your peripheral fields, they'll check your eye health, but you have to remember that vision is more than 20/20. Just because you can see the 20/20 line doesn't mean that your eyes are functioning well together. So if they haven't gone above and beyond those testings, you do have to maybe seek another optometrist or a neuro-optometrist who will go to do more further testing on your visual system. They will check your ocular motor skills. So how are your eyes moving and tracking? They'll test your binocular function. So how are your eyes working together? Are they working where one eye might not be working well with the other? Are they just not in the same place at the same time? They'll check your depth perception. They'll check if you have a visual midline shift. So a lot of people with visual midline shifts will find that they're being pulled when they're walking in one direction. And so now they're walking into walls, they're walking into their partners, they're just not walking in a straight line. They'll check your accommodation function. They'll check for prisms. So yoke prisms is commonly prescribed for balance issues, but also for the visual midline shift. And what yoke prisms do is they help to align your posture and let you see where straight actually is, versus sometimes with that shift, you might think your right side or your left side is straight when it's not. They'll also check your vestibular ocular reflexes. Again, that will be balance issues, or if you're moving your head, you feel nauseous or dizzy. And they'll do other testings if needed, like syntonics, which is light therapy. And we'll always check your primitive reflexes to make sure that all your reflexes are integrated. So what is vision therapy? It's also known as a neuro-optometric rehabilitation that helps treat affects brain injury and teaches the injured brain new ways to compensate for their vision problems. So during therapy, we do work on visual motor activities, which will help with increasing peripheral awareness. So a lot of times with traumatic brain injuries, they tend to really tunnel their vision in and not be aware of their periphery as much. And again, that will affect how you see your balance. It'll also make you more stressed when you're tunneled in, which is like a cycle, because then they'll tunnel you more in, and then you'll scrunch yourself in, and that'll affect your posture and increase headaches and all of that fun stuff that goes along with that. Will help improve eye movement control and binocular visual skills. Will increase visual processing skills. So again, your comprehension will get better. Your ability to discriminate between things will start to get better. So a lot of that visual processing skills will improve. And we will help to integrate your vestibular ocular reflexes to help with that nausea and dizziness. So after vision therapy, you'll be able to read for longer periods of time. You'll have better reading comprehension. You'll be able to tolerate busy environments more. You'll have reduction in your headaches, better balance, decreased light sensitivity. And we always find that after vision therapy, we will have improved the quality of life of a patient who's suffered a traumatic brain injury. We do have a real case presentation person here. This is patient BD. She is a 61-year-old female who presented to our office in 2018 after she was in a car accident in October of 2017, after she had been rear-ended. She was diagnosed with a concussion and had whiplash injuries. Her symptoms again included headaches, light sensitivity, noise sensitivity. She had mental and physical fatigue. She had decreased attention. She had irritability. So she was very frustrated with the way that she was living after her brain injury. She had distress and anxiety. She had nausea, sleep disturbances. She was emotionally sensitive. She had blurred vision, attention difficulties. Tinnitus is ringing in the ears, which can be very common after brain injury. She had confusion in busy sound or visual environments. She actually stopped going to church, which she liked to do just because of there was too much stimulation. Staring behavior, spatial disorientation, losing a place when reading, movement of text. She had poor comprehension and reading problems. We always do a survey about where a patient is and how what is their quality of life, but also a lot of their symptoms and how they rate it. So she actually scored a 208 on her post-traumatic vision syndrome survey. It should actually be 5. So she was very symptomatic when she started vision therapy and when I saw her. Again, before her accident, she used to be involved with church, various committees. She played the guitar. She worked as a deacon. She taught Sunday school and she loved to read. Patient BD did 60 weeks of vision therapy. Usually it's about 40 weeks of vision therapy. Sometimes it can be more, sometimes it's less, but it's usually about 40 weeks of therapy. But after her therapy, she scored at a 49. So she was at a 208. Now she's at 49 with her tinnitus, which being the most persistent symptom, which she was seeing an osteopath for. So after her vision therapy, she actually wrote a really nice letter to us. And I'm going to just read a little bit about what she said. So she writes, after the accident, even thinking was such a painful process. She was frustrated and fatigued. Remembering new information, nausea and tinnitus made the days tough to get through. Her rehabilitation team consisted of a counselor, physiotherapist, massage therapist, osteopath, and vision therapy. After vision therapy, she was doing small synchronized dance steps. She was able to read again. She was playing the guitar. She was able to drive short distances. She was very depressed, and now she's finding joy again. So she found vision therapy very, very useful, in part along with all of her other rehabilitation team. It's not, again, just vision therapy. That's the end all be all cure all. It takes a team. It's a community approach. So it's very important that you're getting the help that you need in those areas that you need it. But if you want more information or to find a optometrist near you, you can go to visiontherapycanada.com and they will actually, you can find an optometrist that actually specializes in binocular vision and has taken these courses to help you with your traumatic brain injuries. And I am done. Any questions?
Thank you so much for sharing all of that. I'll go ahead and just stop the recording here and then we can open up the floor.